We're back with the launch of With You Today, a special hour dedicated to answering as many of your questions as we can about the coronavirus as we face this uncertainty of what's to come. We know you have a lot of questions. We do, too. They've been pouring in on Facebook and Instagram. Keep it coming. We've gathered our team of experts from the medical and mental health fields, consumer, financial words. We're going to pick their brains over the next hour. Let's start with the man we've all been counting on, Dr. Torres. All right, here's a question from Lauren. She wants to know, how long does it take to show symptoms if you come in contact with the virus?
So what they found out is people who start getting symptoms, half of them will get them within 5 days. Almost everybody gets them within 12 days. And that's why they have the 14-day incubation period, to add a couple days on the end as a buffer.
Okay, real quick. I mean, a lot of us, might have a sniffly nose or whatever. What is the telltale sign that this could be coronavirus?
So the two biggest telltale signs are getting that fever and developing shortness of breath. If you develop shortness of breath, that's definitely time to seek medical help.
Okay, this question comes from Hoda across the studio. She read that taking widely used over-the-counter anti-inflammatory drugs like ibuprofen may worsen the coronavirus. I saw that article, too. I mean, that's the stuff you would take to keep your fever down.
And from Hoda, I thought it'd be a toilet paper question.
No, we all did.
It's very theoretical. A French health minister put out a tweet saying ibuprofen might actually make things worse with coronavirus, but it's very theoretical. Nothing's been proven about that. And a lot of experts are saying it doesn't really matter. But if you're concerned, take acetaminophen instead of ibuprofen to reduce your fevers.
Okay, but we don't yet know if that's the case. Okay, Jared is wondering, if you test negative for the virus, do you still recommend staying isolated or self-quarantined?
So if you're quarantined for 14 days because you were exposed, you want to stay quarantined for the full 14 days. Even if you test negative at day 6 or 7, exactly what we talked about. It could be day 12 or 14 before you get it. If you have symptoms and you're isolated, you definitely need to stay isolated until you get those 2 negative tests within 24 hours of each other.
Okay, Linda says she's basically had a dry cough for days, but no other symptoms. Could that be the coronavirus with only that symptom?
Coronavirus can have one symptom, no symptoms, multiple symptoms. A dry cough definitely could be part of coronavirus. The main things are the cough, runny nose, fever are the biggest things, and shortness of breath. Okay, we've got somebody actually on a live shot, Sarah Wilburn of Richmond, Virginia. Hi, Sarah. What's your question for Dr. John?
Yes. How will we know that things are getting better or the virus is starting to slow down? Yeah. And then what are the experts looking for as signs of improvement?
And Sarah, that's a fantastic question. And you hear about them talking about flattening the curve and the wave they talk about coming through towards the end of the summer. That's what we're looking at. We know this curve's going to go up, meaning more cases. We're on the incline right now, and it's going to start coming down. When it starts coming down and sustain coming down, then we'll start saying, okay, it looks like we're getting out of the woods, but we still need to make all the effort to get that down.
But we don't know that until we're testing in a very routine manner.
The testing is, like I said, it's a linchpin to all of this.
Yeah. All right, Dr. John. Thank you, Sarah. Good question. Keep them coming. Consumer questions. Hoda's got that.
You got it, Savannah. We do have some consumer questions. Vicky's with us. All right, Vic. This one is, a lot of women are thinking about this one. First question comes from Kim. She has a nail appointment this week. Is it okay for her to go?
Okay, Kim. The answer right now is we are limiting all non-essential trips out of our house. We're being asked to stay home by public health officials so we can flatten the curve and limit the spread of this infection. The question you need to ask yourself is, do I need to have this done? Does it have to happen now? If you're making a trip out to get food or medicine, obviously the answer is yes.
Yeah.
A nail salon, you're going to be in very close contact with someone else. You're putting them at risk. They're putting you at risk. The official answer from public health officials would be, this is not a good time.
This is a no. Okay, so we're on the topic. Robert is a hairstylist, and he wants to know, and I have a friend who's also in this boat right here, should he cancel all of his appointment? Now, keep in mind, these guys are trying to pay their bills, and they need income.
Yeah, this is their livelihood. They don't have paid leave. They're in that same boat with so many other workers who, if they stay home, they're not getting a paycheck. I wish I had a crystal ball to tell you how long this is going to last and when it's going to be over. What we do know is the more that we do now to hunker down, the shorter and less severe the impact will be to our economy. So what I would say to Robert is, probably a lot of your appointments are canceling on you in addition. So if you can, take this time, be healthy so that when you get back in the game, you're able to do your job.
Yeah, I do think it's important that we make our own choices because sometimes in different communities, the message is confusing.
Right.
Some communities are cracking down. Some are saying, oh, it's okay. We're going to keep this open and that open. And you really kind of have to go with what's kind of your inner compass.
We're hearing some governors saying we need some federal rules here so that everyone doesn't state shop and just do their own thing.
All right, we've got a question from Fran. Let's roll the tape.
Hi, my name is Fran McEwen. I'm from Jacksonville, Florida, and my husband and I like to go camping in our travel trailer, and we were wondering if that was still a safe option for us.
A lot of people love to do that. They do tell you to get outside.
Yes.
So what do you
Doctors say
say?
that's so important for your mental health, to be outside, to be with nature. The thing is, Fran, the president is asking all Americans to limit, basically to stop discretionary travel.
Right.
So you've got to ask yourself these questions from the CDC. Do you have any underlying health conditions?
Right.
Are you going somewhere where there's a coronavirus outbreak or the potential for a coronavirus outbreak? And that could be where you're heading. Do you have a plan for what happens if you get sick? These are the questions you need to ask. And then when you come back, are you going to be in contact with people who may be vulnerable? It's not just about you, and it's not just about going about with your normal activities. This is not a normal time, and we are going to have to cut back on some of the things that we like to do.
On another note, if people just want to go out and get fresh air, I took the kids out. I had them in the stroller, and we were walking, and there was nobody around.
Right.
But fresh air is important, and the UV rays are important.
Yes, getting some of that vitamin D, absolutely. If you can go out at times where it's not busy, you're going somewhere, maybe you don't have them on the playground touching the equipment, but you have them in the grass.
A lot of people are home, they're shut in, and they have pets. And one of their big concerns is, can my pet get it? What's the answer there?
The CDC says right now they have not identified a single pet, dog, animal, any sort of pet in the United States with coronavirus, and that they do not believe that there is a risk of pets spreading or contracting coronavirus. That said, they haven't done tests about, this is another question I get is, how long does it live on pet fur? If someone pets my dog, do I have to bathe the dog right away? There's no test that has been done or study that has been done. So the idea is you shouldn't be close enough for someone to be petting your animal anyway if you do take the dog out for a walk. Just stay in your own space.
Vicky, thank you. And we're happy you're here.
Yes,
I'm glad that all worked out. Just ahead, we're going to get your questions about navigating family life, including tips on homeschooling your kids.
As more cities issue curfews and business closures, money's on everybody's mind. The economy, everyone's worried about it. Our first question we can get through FaceTime. This is Pete Torres. He's a local restaurant owner in Chicago. And gosh, Pete, we know these are hard times. What's your question?
Yeah, thanks for having me. Just curious, we're really worried about our employees here, and just wondering if we're going to see any leadership from insurance companies on this issue to mitigate our losses and to best support our employees.
Pete, I just want to say we are 100% with you. We've talked in the last few days how it's important in terms of health to close down restaurants and bars, but it's really important to think about your livelihood and all of your employees. Now, what private insurance companies are doing, we don't yet know, but as far as the government, today at 9 o'clock, the president is actually meeting with restaurant executives. We know that the Small Business Association, and I urge you to go there, SBA.gov, is working overtime to process emergency loans. And you said you're in Chicago, did you say?
Yeah, that's right.
Go to the state of Illinois, and I want you to be, when you look up your state, make sure you're not looking up .com, any websites, always .gov, and look up the development website, because that's where we're seeing more and more emergency funding. And I just want you to know this is being considered. Your employers are being considered, and I know there's not resolutions right now, but even companies, possibly your credit card company, your utility company, broadband and internet providers are putting a hold on a lot of people and companies' bills to get you through this time.
Thanks.
Pete, we're with you.
We are with you.
And thanks for caring about your employees.
Yeah. All right. Thank you.
Sending our love.
All right. We've got a question for you, Ms. Ruhle. This comes from Tess. She's currently under contract to sell her home and buy a new one. Should she be concerned about mortgage rate increases, et cetera?
Okay. Her mortgage rates are not going to go up. Remember, 2 days ago, we saw the Fed slash rates. So that shouldn't be a worry. Something to consider, though, if she's moving in the next month, she's going to have movers in her house. She may have furniture delivery people in her house. So make sure she's very transparent with every company, everyone that's going in and out of her home, because it's not just financial, it's physical. Remember, all of these people in her life, but as far as mortgage rates going up, that's not something to consider.
We're a transaction. Should you not be doing these kinds of transactions?
Should you pause?
This isn't something you necessarily need to pause. Listen, the government has told you all the things that need to pause as far as being around a whole lot of people, being with anyone, over 10, but 10 people, not age of 10. But as far as a financial transaction, that's okay. The system is absolutely still working.
Okay. Lynn has a question about production facility. She said, are they ramping up production to get shelves stocked? I assume she means grocery store shelves, that kind of stuff.
And the answer to that is absolutely yes. We were talking about it yesterday. Louis Vuitton, right? A luxury brand is taking their perfume manufacturing operations and making hand sanitizer.
True, which is great, but that's in France.
Okay, but that's also just a one-off. We
Yeah.
are seeing stores, Walmart, for example, extend their hours. You talked about it earlier. Some grocery stores giving specific hours for senior citizens. But I promise you, local and national chains are doing everything they can to work on their supply chain. Amazon yesterday announced it is hiring another 100,000 workers, increasing pay by $2 to help get all this product out.
Judy has a question for you, Steph. She's got taxes on her mind. She had a tax appointment. They canceled it. So she wants to know if that April 15th deadline is going to be stretched.
The president has already said we're going to extend that deadline, but we don't know details. So to be on the safe side, you may want to preemptively file an extension. But for some people, they really want to get that rebate.
Yes, they
so
want
for
money.
those who can get theirs done, you may want to get it done sooner rather than later if it's that money that you're really going to be in need of.
Okay, our last question is Phil. He's self-employed. He wants to know how any of these recent financial announcements help him out.
Yeah.
This is a huge issue. And Phil, we are with you. We've got more self-employed people, gig economy people than ever. And unfortunately, we don't have the regulation to match it. We didn't catch up with it, but it's being focused on right now. And if you work for some of the gig economy companies, Instacart, Lyft, Uber, they are now providing support, sick leave for their employees. If you are truly self-employed, I go back to the Go to Your State website, the development website, and there are plans in place and more are coming.
All right. As many of you have kids of all ages and they're stuck at home, and that definitely raises some specific concerns. Got a lot of questions about that online. And in collaboration with Facebook, our team of experts is here to help. We've got Dr. John Torres. He's here along with Jamie Howard now. She's a clinical psychologist at the Child Mind Institute. It's good to have you both here. Thank you. So let's get to the questions. Kathy on Facebook writes, this is for you, Dr. John. I'm 77 and have my 6-year-old grandson here today. My primary care doctor just told me no more contact with him or other family members as they are still out and about and going to stores. Can I see them outside as long as they stay 6 feet away and are not coughing or sneezing? I mean, so many grandmas and grandpas feeling this.
I get a lot of questions from grandparents wanting to see the grandkids, and it depends on why your primary care doctor is telling you to avoid them. If it's because you have issues, autoimmune issues, immune system issues, if you have risk factors, those different types of medical conditions.
I mean, more than just age. More
than just age, then you want to stay away from them. Even outdoors, you have to be a little bit careful because it's hard to tell a 6-year-old not to touch grandma, not to run over there and give her a hug, not to throw her a ball or anything like that. If you're a healthy 77-year-old and don't have any other conditions, then I don't see anything wrong with being outside as long, again, as that 6-year-old understands, hey, let's have this separation. Here's why we have the separation. And I wouldn't even play ball or anything, but just, kind of talk to them. And
stay 6 feet away. No hugs and kisses. None of that stuff. Okay, it's just temporary.
It's tough, and it's just temporary. We will
FaceTime is great right now for Grandma and Grandpa. Kelly from Facebook, Jamie, this is a question for you. What advice can you give on talking to your high school senior who is showing signs of depression and anxiety due to no school activities, no spring sports, and the possibility of no prom and graduation? This is a biggie.
Yeah, it's super disappointing. So it's totally normal for kids to feel sad, even angry, disappointed right now. So you can validate that. But in time, in the next few weeks, we want kids to start to accept this. And then if they're still feeling sad or irritable most of the day, nearly every day for weeks, then we want to intervene. And we can intervene as parents and we can say, you need to come out of your room. We're going to watch a movie as a family, for example. You need to go in the backyard a little bit. Or you can even see a mental health care professional right now. We're all seeing our patients remotely.
You are, okay. Dr. John, this question is Elise on Instagram. She's asking, any feedback on breastfeeding? Should we be exposed to the virus at all?
We still don't know a whole lot about this virus. In particular, we don't know much about pregnant women, but the American College of Obstetricians and Gynecologists came out saying there's really no evidence that pregnant women have any increased risk of getting it or increased risk of complications from this. As far as breastfeeding, it doesn't seem like it passes through the breast milk. And what they do say is the baby has a bigger chance of catching coronavirus if the mom has it, if she's breathing or coughing or sneezing on them, than through the breast milk itself. So just make sure that you cover up, you do the things you need to do to protect the baby from you. And if you are breastfeeding and you have symptoms like that, think about pumping and giving them that way, somebody else breastfeeding them at the same time.
Okay, this is Lauren on Facebook asking, why are states shutting down schools but not daycares? What's the difference?
It was interesting. Yesterday in the press conference that the White House task force had, they asked that question, and Dr. Fauci paused for a minute and said, you're right. we should look at this, at putting daycares in the same equivalency as schools.
I thought they
And so I think
did.
they're going to look at it and they're going to say, let's go ahead and do that. But at this point, there's really no difference between the two.
All right, Jamie, this is a complicated question for some families. This is a viewer who wrote, with split families, kids are going back and forth between parents, homes, family, and friends. Is this safe? What's the best practice?
From a mental health perspective, you want to have routine and predictability. So if you can maintain your routine for switching homes, that's great. Hopefully you're on the same page about social distancing and having people inside the home. If not, maybe you need to change and have chunks of time, larger chunks of time, but tell your kids you're doing that so that it's still predictable for them.
What do you
And from a health
medical
perspective, for the most part, the same thing. The more contacts you have, the more risk you have, and so you want to be careful with that. At the same point, if somebody's sick, obviously in one house, then absolutely do not go to the other house. If somebody's not sick, like Jamie said, just make sure they're practicing the same type of routines, the distancing, the hand washing, all that stuff.
All right, Jamie, thank you so much. Dr. Torres, thank you.